Thank you. Thank you so much. Thank you. Now, with this, ladies and gentlemen, we are getting to the last session of the day. And I don't know if this was coincidental or planned, but very evidently, in the later half of the last panel discussion as well, one topic which was highlighted was people. So whether it is nurses, whether it is the staff, it is the quality of the staff, the attrition that was at question, because ultimately we all agree to the fact that medical care, infrastructure, capital investment all boils down to the fact that ultimately we need that staff, that people, the quality of the people who would impart that medical care to the patient ultimately. So, ladies and gentlemen, our next and the last topic before we move on for the National Healthcare Awards seminar as well that will be conducted shortly. We'd now like to invite the Chief Business Officer for Jobizo India, Mr. Tanesh Arora, to please step up onto the stage and share their solutions exactly for this problem. So, welcome very much, Mr. Arora. Ladies and gentlemen, let's give a big round of applause for Mr. Arora, please. Welcome, sir.
Sure, sure. Thanks a lot. Thanks a lot. Good afternoon, everyone. Yep, thanks a lot. Good afternoon, everyone, and really thanks everybody here, especially the incredible team of VOH. I'm sure that lots of efforts has gone behind, be it Dr. Naveen, Pinky, Katyani. Yes, you guys have been doing really a wonderful work. I'm sure this forum we all have attended till now, and today it is my last session. I just want not more than 15 minutes of yours, but yes, everybody has talked about various problems and the challenges in the healthcare industry. What we are talking about is the real-time ground-level problem and how we can bring the solution to these problems. That is what we're gonna be representing. I am Tanesh Arora. I am the Chief Business Officer for Jobizo, India's only tech-enabled healthcare hiring platform. Can I have a AV, please, before I start my session? Thank you, team. So I'm sure by this AV, many of you must have understood that we are those critical support enablers who work behind the curtain, where our healthcare heroes are actually showing their efforts on the field, right? Yes, we work very closely with the hospitals and the HR people around to bring the right people at the right time and at the right moment. Uh, I'll go to the first slide. Although there has been a lot of stats and information which has been shared by our good dignitaries, and Mr. Ariman from Praxis has also shown us good insights about the data where we all are struggling or probably are challenges in the healthcare industry. I will set the context with these challenges on in couple of slides, and by the time I'll come back with my solutions, how I am providing the solution to the healthcare industry. Yes, today we are sitting. Today we are sitting within big, I would say, exploding industry. Overall, healthcare industry is going to be a almost $520 billion industry, right? And out of that, hospital itself, covers 120 billion as of now, right? That's the power, or that's the input where we all are working together to bring this industry to the next level. Yeah. If we talk about pharmaceuticals, if we talk about medical devices, they all put together, it is 86%, rest are the others. Overall, when we say that, yes, hospitals are 54%, after that 54%, the key pressure for all the hospitals are their 50% of their cost. The 50% of their cost goes into the hiring of healthcare heroes, which is our doctors as well as our nurses, and which is huge, huge in terms of running any hospital. Not only about this, the limited resources which is actually hampering, it's not about just 45% of cost going to the doctors and nurses, but the availability of the doctor and nurses, that is where we actually work for. In India, we understand that there are, there are total 1260. I would reiterate the talent shortage here. We are even struggling from the third world countries like Brazil, right? And India, where we talk about 1 doctor per 1,000, it is not. We are sitting at 1260 population for 1 doctor. That's where our problem is. And I'm sure all these current hospitals who are sitting here, many of you are already working with us, may not be aware of, but yes, many of you are definitely using the locum services. That is where our solution is, and that is the challenge what we are actually working to help each and every hospital and each and every management of this particular hospital. So these are the current key challenges of the hospital. Yes, we have a talent shortage. We all know that. Overall, 11 lakh active doctors out of this 13 lakh registered MBBS doctors, right? There is a cost pressure as well as the salary expectation all these health heroes do for. There is definitely a fragmented and a slow hiring process. We all understand this is the key challenge for any hospital or any healthcare unit, how to grab and how to improve their efficiencies. Apart from that, this complete healthcare hiring is actually fragmented and unorganized, and which is again further causing the delay of getting the right people on the board, which means there's a lead time. There is a hygiene or the compliance which every hospital goes through in terms of verifying the data or the information what that particular candidate or the professional is showing in their biodata. So there's a lead time, and there is definitely a trust gap, right? Whether they are hiring a right person or not, whether these are verified, by the time the verification is done, the overall lead time goes to 52 days. So in India, compared to any other country, it's 2x. Total days for hiring 1 doctor, it goes to almost 52 days. So while all these problems, how Jobizo is solving and helping every hospitals and the management of the hospitals to enable them and empower them and run their system smoothly. Before I cover this particular part, I'll give you a live example, not very far, but last month example when I was in Bangalore meeting with one of the esteemed hospital, wherein the hospital had just opened, launched their systems in a soft launch. 2 days the doctor were present. After 2 days, the OPD doctor was not there, right? And probably that time I realized the power of our tech-enabled application, which really helped them in getting their function smoothly run in the critical phase, which is obviously for any hospital. It's not only just the lives, but also the reputation, which is always on the stake for any hospital to run for. Yeah. So what do we do for? We do the sudden fulfilling of the hiring through what? Tech-led. We have algorithm which worked at the back end, right? We give you the right locum, which is matching your requirement. And then there is a flexibility around. It is not for the complete month. It can be a 1 day or a 2 day or a weeks. There are shifts. So as of now, we have actually completed almost 1 lakh kind of shifts in the key metros where we are operational, right? We have almost 80,000 verified professionals. Out of that, more than 55% are the doctors and rest are the nurses. So we cater to both nurses as well as doctor in locum. The time, right? We all understand that there's a lead time. How do we do that? And honestly, we work in three different verticals. One is the international hiring, second is the permanent hiring for doctors and nurses, third is the locum, which is our tech-enabled platform. And every 26 minutes, we are actually employing or deploying a good doctor in various healthcare partners. We have, as I mentioned, we have verified platform, which is again enabled tech. We have a third party who is doing all the verification for them and then getting them on board. So the pool is always ready. And there is a real-time job boost. The moment a hospital pause their job on our platform, there's a algorithm which works and help them in giving the right match to that particular job. We all talk about various tech integration or digitalization of the hospitals, be it on a diagnostic side. We all understand that there's a lot of things going around. There are paperless hospitals which are becoming. There are clinical outcomes which are completely tech driven now, right? There is a patient centric approach also for bringing technology there. But nobody is talking about how these doctors will be empowered, or rather how these hospital owners will be empowered to run all this thing technically, with the technology, with the help of technology, right? That's where we come into the picture. We actually help them in right matched AI-led hiring, right? Today, all these hospitals are running locum in the WhatsApp groups. I'm sure you all are aware of. And all these WhatsApp groups are completely unorganized. Nobody knows what kind of data is flowing, and nobody knows what kind of pool they have in their WhatsApp group. But we present you the verified, trustworthy and tech-enabled. We all adopt technology these days, right? And I don't know why this particular thing was missing. So that's where we are coming for, and we represent our app, right? And this app works on both the sides. There are professionals and there are recruiters, or I would say the employers. So obviously employers can have their shift management in terms of how many shifts they want to put in, how many I would say matchmaking they are getting the resumes over there, right? And from professional side, yes, I would give you another example. There was a RMO, I would say, just passed out of the college, but not getting the right RMO job. And she was actually working in a transcription, rather in a back end of one of the, I would say, corporate. You getting used their degree, but probably not the skills. She was not getting acknowledged to clinical skills. But when she came to know, yes, these RMOs can have a temporary shifts also, wherein she can gather, I would say, clinical experience also. That's where probably we feel happy to partner and help them out in bringing and solving the problems. So yes, as I mentioned, we worked on the speed. We basically worked on the process, which means streamlining the process, getting you the speed, and compliance requirement, which is the verified, 100% verified professionals. Yeah, currently we are present in 3 cities. We are sitting at 8% of the penetration. We are working almost 400 plus various hospitals in these 3 cities. We are welcoming more associations, and that's why I thought it's a right forum. While we are expanding in tier 2 cities, our agenda or our aim is to connect these tier 2 cities to the metros and help all these hospitals in the tier 2 cities through our platform and technology-led platform. We look forward to partnering various more hospitals, and the forum is open for the questions, please. Thanks a lot. Any questions? I'll be happy to address right now. Anyways, I have my national sales head and the regional sales head here. They would be getting in touch with you, Sahil Manchanda and Miss Sanjeet Kaur, right? She'll be here. She'll be touching base with you and understanding your problem and how we can help you out. Thank you. Thank you.
Wait. I mean, you are providing, this is a very nice initiative. I want to understand that what all cities you are covering suppose I have a hospital in Sonipat or Panipat.
Yes, sir.
Will you be able to provide me locum there, or you are still, I mean, in metro cities as of now? So what
Sir,
are your plans? I want to understand. A little bit
definitely,
about
sir.
that.
Thank you for asking this question. Currently, we are present in 3 metros, which is NCR, Bangalore, and Hyderabad, and we are doing extremely well. The second phase of our launch is Jaipur, and definitely the greater NCR part, as you mentioned. Yes, we want to connect all these smaller cities with the metros so that there is a seamless, sharing of resources, especially the way we are working out. Yeah, we gonna be by year 2027 end, we gonna be present in almost 15 cities, and all these 15 cities are the tier 2 cities primarily. Thank you.
Thank you. Thank you very
Thanks.
much, and many congratulations.
Thank you, sir. Thanks a
Thank you.
lot.
It's a good initiative. I am working as a director in St. Fortis Hospital.
Thank you, sir.
Sometimes we need doctors on locum
Yes, sir.
for doing shift duties.
Yes, yes.
We get the main challenge. Some doctors want the payment in cash.
Right.
In your app, what is the payment system? Is it done through the application or payment directly done to the doctors?
No, sir. So I understand this was a problem shared to us while we were developing this ad and we were working on the beta phase at that time. Yes, this was a problem. So we rather pay it to the doctor immediately, and we indirectly we bill you after 15 days.
Okay, but payment is through your app only.
Through our app and through our systems, basically.
Thank you.
Sohos are attached to our app, and that's how the bill is generated. You can see the bill in the app also, and that the payment can be done to the company, to us. And we will pay, we have already paid to the doctor by the time the shift is over.
Same question from this question. In some corporate hospitals, there is payment through departments or payment through hospitals, because some departments are outsourced. If,
That's right.
as a director of my department, I want payment to be billed to my department, not
That's
to the
right.
hospital.
Exactly, sir. This avoid lot of corruption. More than corruption, I think the standardization of the process, right, which helps you out. So it will be billed to the hospital directly where it is going. That the whole arrangement is there.
Thank you.
Anybody else? I think we're done. Yeah, we'll open for the lunch now.
Well, I invite Ms. Pinky from the Voice of Healthcare team to please step up onto the stage to present a small token of our gratitude to Mr. Tanesh here. Sir, if you can join us to the center of the stage. Thank you very much, ma'am. And ladies and gentlemen, we also have the team here from Jobizo. Thank you so much.